Artlist.io.
Tuberculosis is a potentially serious infectious bacterial disease that mainly affects the lungs. It is caused by a bacteria called Mycobacterium tuberculosis, and it is spread when an infected person sneezes or coughs.
Music
That is to
licensing
say that
reimagined.
it is an airborne disease, and it comes by droplets from those sneezes and coughs. You could experience things like chronic bloody cough, chest pain, shortness of breath, swollen lymph nodes, muscle atrophy. Others could be chills, fever, fatigue, night sweats, and all. But all these,
Artlist.io.
I call them guesswork. My advice to any patient is when you notice any unusual thing in your body, try as much as possible to go for a test so as to ascertain what it really is.
Music licensing
In the
reimagined.
world today, about 40% of adults are infected with tuberculosis, and approximately 1.5 million cases are put on treatment yearly. Every positive case can infect approximately 10 to 15 persons, thereby increasing the pool of infected persons. In Nigeria, this nation records at least 100 tuberculosis cases.
Artlist.io.
First things first, vaccination. That's immunizing children with vaccine. So that of tuberculosis, it is called BCG vaccine. That is Bacillus calmette-guerin. That's the vaccine they give to children to prevent tuberculosis. Another one, as much as possible,
Music licensing
avoid being in
reimagined.
crowded places. Also, if you happen to be where people are, try to maintain safe distances from people. Don't try to congest yourself so as to avoid things like this. All in all, try to go for regular medical checkup so that if there is anything wrong with you, you detect it early and start treatment. Because what kills people most times is that they will have a particular thing worrying them. They may not know they are
Artlist.io.
suffering from that thing until that thing has eaten deep. Okay, there are several treatment regimens recommended for tuberculosis disease, but I'll just hit the main ones that have been proven to be very
Music
effective.
licensing
Now,
reimagined.
tuberculosis treatment can take 4 to 6 or 9 months. It all depends on the particular regimen you're using or how strong the patient's immunity is. First, we have the 4-month rifampicin mosifloxacin TB treatment. We have the 6 to 9 months ROIPE TB treatment regimen. Now, this ROIPE regimen is a combination therapy of rifampin, isoniazid, pyrazinamide, and ethambutol. So this lasts for 9 months. But I will advise that the shorter the regimen, the more effective the treatment.
Artlist.io.